In this video, I'm going to look at stereotactic radiotherapy from a patient's point of view. Now, I'm not any sort of an expert, I'm just a patient who recently received stereotactic radiotherapy, and these are my experiences. It's worth noting that every patient's experience is different because every patient's different, and this is about how it worked for me. And if you get stereotactic radiotherapy, it probably won't be exactly the same for you. The hospital has a strict patient confidentiality policy, but as the only patient in the video, I'm waiving that right to confidentiality. They may contact me and ask me to take the video down, and if they do, I will. But currently I've got 2 subscribers, so I'm guessing the probability of anybody in authority ever viewing this is quite slim. So a bit of background. I was diagnosed with melanoma, skin cancer, in 2015. Just a mole. And unusually, despite catching it fairly early, that skin cancer 5 years later, even with treatment, has spread to my brain. In order to destroy the cancer tumours, this treatment involves hitting them with radiation. In the past, that would have been low doses of radiation to the whole head over several weeks with a whole myriad of complications, possibly affecting my ability to think and work long term, and in my case it probably wouldn't even have been very effective. Stereotactic radiotherapy, or radiosurgery, is a single high dose of radiation given directly to the tumours and avoiding all the surrounding healthy cells. It's more effective, they say it's as effective as surgery, and there are fewer side effects. I should be able to go about my daily business immediately after the treatment. We'll see. Because it's my sister's wedding the day after my radiotherapy, and I'm still hoping to attend that. So, 3 tumours, and this being the 3rd time I've had recurrences. We don't expect the radiotherapy to cure my cancer. They can only destroy the tumours as they are, the ones they can see on the MRI, and it will grow again from scratch or from whatever's left. It will come back. But this will buy enough time to try another treatment that might make it possible to manage the cancer longer term. Cancer in your brain makes your brain swell up. Symptoms of that might include double vision or weakness on one side of your body. Nausea, vomiting is also a possibility. In my case, I just felt some pressure in my head and a sort of inability to concentrate. But I'm not very good at concentrating anyway, so I just thought I was more tired than usual. I also lost weight. Radiotherapy itself swells your brain. So in order to stop me dying from a swollen brain, they put me on a short course of dexamethasone. That's the same steroid that's proving effective with COVID patients. It was unbelievably good at relieving the headaches, but I couldn't sleep a wink at night while I was taking them. But it was only a short course in order to allow them to get in and do the radiotherapy. Stereotactic radiotherapy is fascinating if it wasn't happening to me. First they took an MRI of my brain. I'm guessing it's some sort of special measuring MRI because I had an MRI less than a week previously. They use the images from that to calculate the arcs that they'll need to accurately target the tumours while avoiding the healthy cells around them. They take about a week to complete the calculations, and they set up the software for the radiation machine. I don't even know what it's called. So while that was happening, I got another appointment to attend the mould room to have a thermoplastic mould made of my head, front and back. It's not like a sculpture, it's just to fix my head in place so that I don't move during the treatment. That process of making that mould, takes about 20 minutes. And it's a bit like some kind of weird, expensive spa treatment or something. I was lying there for about 20 minutes. I was fine. There was always somebody in the room. I could sort of see through the holes in the mask. There was no issues with breathing or anything. Talking was a bit difficult because it moulded over my chin, so I just lay there and said nothing. The mould was then tested, and they did a quick CT scan to check the positioning and get everything in order for the main event.
Alright. No bother?
That's the cough.
Well, we can just cough right there.
You just cough away. Just lift the leg very slightly going. Yes, you control yourself well.
They're alright?
Yep.
Yeah, we'll take more contact with the scanners, see what way they are.
So, a week later, I was called for radiotherapy. 3 tumours. They decided to do them all in one day. There were options to do them in individual days, 3 days or 2 days, but one single session was the best balance of convenience, side effects, my ability to lie still, speed, their ability to treat more patients, all that stuff. So I was taken into a side room, it was sort of more of a cupboard, and the radiologist explained everything to me again. Now, I've got to say, having talked to other patients in other hospitals, Belfast Cancer Centre staff are really good at explaining everything at every stage. I've always known exactly what was about to happen, what I need to do afterwards, if anything goes wrong, who to contact. I have never been left wondering, and they are excellent, friendly, helpful, knowledgeable, just I can't say enough good about them. The radiotherapist seemed confident that I would be able to attend my sister's wedding the next day, so that's good. And I assured her I wouldn't be disappointed if I ended up with superpowers after the treatment. Into the radiation suite, it was like science fiction spaceship. It was really modern. It was a big circular pod rather than a room, dominated by the massive radiation machine in the centre. There was music blasting. It was okay music. It was, I recognised most of the songs. I wouldn't have chosen them, but, well, it was something to listen to. They got me to lay down in the bed and they fixed my head in place using the mould, and it was fine. It was comfortable. The session lasted just over an hour. 3 tumours targeted one at a time. Each tumour took around 20 minutes, depending on their size and whether the machine needed to carve 3 or 4 arcs. I honestly don't know how it works. I tried to get her to explain it, but it was way over my head. Now, I was determined that while I was lying there, I thought, I'll be able to work out which tumour they're targeting. It sort of, there was a very slight sensation of something happening inside my head, but certainly no pain or discomfort or anything like that. The bed rose up and tilted to get me into the exact right position, but actually because I couldn't see everything, I barely noticed that. And then the machine worked its way around me. I couldn't see very much through the mask, but there was lots of whirring and clicking going on, so I knew it was doing something. They asked me after the first tumour was done if I wanted to take a break, walk around, and I was fine. I said just fire on with the next one and just get through this. That was probably a mistake. Halfway through the second one, I got a bit claustrophobic. So after that one was finished, I got up and walked around the room for a while before the next one. And the final one, which was the shortest, but I found it really difficult to stay still. By the end, I was sort of pinching myself and trying to distract from the feelings of discomfort and claustrophobia. I was agitated. I was fine as soon as I was able to sit up and get around it, walk around, but during that time with my head fixed and just, Actually, if I was doing it again, I would probably get them to play my audiobook, that I'm listening to, whatever I'm listening to at the time. I would take a stress ball or a fidget cube or something just to distract me. That would be my recommendation if this is going to happen to you for any, for a length of time. Afterwards, I was actually stunned by how confident they were. We don't expect to see you again. If there are any problems, see your GP. If your GP can't help, well, here's a list of numbers, but nobody's going to pick up. Just leave a message. We won't follow up with you. Your oncology team can do that. Now, you might take that as not caring. I was left the impression that they were saying this works. We've got loads of experience. You will only have minor side effects, which will pass. We are an extremely efficient team. That's what I was left with, and actually I'm utterly impressed with the whole experience. So in my next video, I think I will make a video of my sister's wedding, which was less than 18 hours after what is effectively major brain surgery. So I'll see you then.